My name is Adelheid Wiemer-Kruel. I'm living in the southwest of Germany, and I'm working in a huge epilepsy center for children and for adolescents, as well as for adults, and adults also with very severe handicap. This is a very old institution coming from 1881. Yes, that's that. And we are treating all kinds of epilepsies. And for sure, on account of our long tradition, we also have a great experience in tuberous sclerosis complex in treating patients with this disease. So we are also have a certification coming from the German TSC Alliance that we are really a TSC center. And I'm working in the clinic for children and adolescents, and I am a leading consultant in this clinic, running my own outpatient clinic, and also treating for sure inpatient children. Ask me what kind of seizures you have to be aware of in tuberous sclerosis complex. I think the main and most important seizure type are infantile spasms. These infantile spasms are typically age-related. That means they are beginning at the age of 3 to 12 months with a peak at 5 months. It's a brief tonic contraction of the axial and the proximal limb muscles, and it's an abrupt onset as well as an abrupt termination. It's very short. It's only about 1 second. That means it's slower than myoclonic jerks, but it's much longer than tonic seizures. Most common, you have a moderate flexion of the hips. That means the legs are coming a little bit upwards, and also a flexion of the head, like a smooth nodding perhaps. And the arms are always involved. That means they're coming just in semi-flexion, not as this, but a little bit less. Normally, it's a very violent movement, but it also can be very mild. Sometimes the seizures are fractioned. That means only a flexion of the neck, or like a bobbing of the head, or only a mild bending of the body, a shrunk-like movement. After the seizure, you have a motionless period and a diminished consciousness, up to from 1 or some seconds up to 90 seconds maximum. And you also have alterations and pauses of respiration during the spasms. That's very common, about 60%. And at the end, you often have a cry or a laughter. The cry, that's very important for you to know. It's not because the infants have pain. It's just belonging to the seizure itself. So it's not a crying out of pain. It's just a crying out of the seizure. And these infantile spasms, these seizures, are happening in clusters or series. That means one after the other. And it's always, or very often, happening during awakening. These infantile spasms are not only typical for TS, they also can happen in quite other diseases, in severe brain malformations, in genetic diseases, after severe asphyxia, after infections. It's really in quite a lot of situations where it can happen. And the infantile spasms generated by TS are only about 15 to 20% of all other infantile spasms. The EEG in infantile spasms is quite typically, it's a chaotic seizure pattern. And during this chaotic seizure pattern and these infantile spasms, this is very dangerous. You have a psychomotor development which is going down or which is arresting. So in former times, this was called West syndrome. Nowadays, this is called infantile spasms. Infantile spasms are a very severe form of epilepsy. And the most or the greatest problem is that it is always combined with a severe decline of development or an arrest of development. And the decline of development is greater the longer the seizures are going on. And it's also more difficult to treat the longer the seizures are going on. So you have to do everything to stop the seizures as quick as possible for development, and it also makes treating options much better. And you can call infantile spasms as an emergency case because, as I told you, you have to stop the seizures as quick as possible. Now we should speak a little bit about therapy. Let's start with standardized therapy in infantile spasms. The standard epileptic drug of choice is vigabatrin. So this is the first choice, vigabatrin in infancy for infantile spasms, but as well also possible for focal seizures. Second in infantile spasms are corticoids. If vigabatrin is not working as well, that means if you don't have seizure, if the child is not seizure free. And corticoids are usually used when you have Hübsch arrhythmia in the EEG. If you don't have Hübsch arrhythmia in the EEG, you can also try, for example, topiramate, which is told by Curatolo to work very well. And the third choice in treating infantile spasms is already ketogenic diets, because ketogenic diets, as you know, are entering into the mTOR pathway. They are down-regulating the mTOR pathway, and by that, ketogenic diet is very effective in TS, especially in infancy, because infants nearly eat everything what you give them, so they don't have any problems eating fat. So that's a very good choice. And if these three, that means if vigabatrin, corticoids, and ketogenic diet are not working well, then you also have to think about epilepsy surgery, because epilepsy surgery can also be done in infancy. And it's not that bad to do it in infancy. In contrary, it's good to do it because if you remove one part of the brain, the other side can take over the function of the brain you removed. And this is the brain plasticity, and this is very important. So the earlier you do the operation, the better for brain plasticity. But on the other hand, it's better for development, because the seizures and especially these infantile spasms are not good for brain development. It's arresting and it's going down. It's declining. So if you do epilepsy surgery and the seizures are stopping, then you really give the child a good chance to develop and to be seizure free. For focal seizures, you don't have that standardized therapy as you have for infantile spasms. For focal seizures, you can use any anti-epileptic drugs, which is good for focal seizures, but there is no specific therapy beyond the first year of life, because in the first year of life it's vigabatrin, but beyond the first year of life you can take every anti-epileptic drug you ever want. There are some anti-epileptic drugs for focal seizures which are very effective. For example, levetiracetam or lamotrigine. Lamotrigine is very good because it's not so much affecting the development, or it's not making tired, and it's good for mood. It's not making aggressive, but also oxcarbazepine or carbamazepine can be used, as well as lacosamide or valproate, or Germans just like to use Sultiam. And there are quite a lot of, as I told you, every anti-epileptic drugs for focal seizures can be used, and it depends a little bit on the EEG. If there is more generalization, then you go perhaps more for valproate, lamotrigine, or also topiramate. If it's more focal, you go to levetiracetam, to oxcarbamazepine or carbamazepine. And if you have already used 2 of these focal anti-epileptic drugs, and if this is not working good enough, that means you don't have seizure freedom, then you can also discuss about everolimus. Everolimus is licensed up the year of 2 years of age. And this can be very effective, especially in younger children. That means if you wait until they are in puberty or adults, then they are perhaps not that. Then everolimus perhaps is not that effective than in early childhood or in children. That's much better, and they are better responding to everolimus. And the better, if you have seizure freedom in early years, then you have a better development. So this is really a good option. But if everolimus is not working as you want to have, that means you don't have seizure freedom. Also in focal seizures, you can think about epilepsy surgery. Then you have to evaluate if this is a possible option. That means you put on the EEG on the EEG electrodes just on the head, and you have to register several seizures and to look from which part of the region are they coming. Are they coming always from the same brain region? And this brain region and this EEG point is pointing also to the main tuber in the MRI. Then you have a good option for having a good result in epilepsy surgery. Or CBD is a plant-derived cannabis-based medicine. It's lecensed in Germany and in the most European countries since October 2019 for treating Dravet syndrome or Lennox-Gastaut syndrome. And it's only licensed in combination with clobazam, and after patients older than 2 years of age. Lennox-Gastaut syndrome can be possible as well in TSC. So if you have a Lennox-Gastaut syndrome in TS, that means if you have most tonic seizures during nighttime and a typical EEG pattern, then you can do it by this licensing. You can also treat with cannabidiol. It's, as I told you, it's only licensed in combination with clobazam. The efficacy of cannabidiol is raised up by clobazam, and vice versa. The efficacy of clobazam is raised up by cannabidiol. But cannabidiol sometimes is a little problematic in TS patients because it can worsen behavior, it can make more aggressive or more active, or yes, being terrible active. So that's perhaps not that good, and it's not licensed, as I told you, for just focal seizures. So in the US, that's new. The cannabidiol has been licensed this October in 2020, and it's licensed for TS patients older than 1 year, so that's young than the European license for Dravet and Lennox-Gastaut syndrome, and it's licensed without clobazam. That's also very good. So if we can take in future, that means next summer perhaps, the license from the States, it would be good if we don't need to add clobazam. And the process for licensing in Europe and in Germany is going on. The pharmacy company is very active about that, for sure. So what is important to know about cannabidiol or CBD in TS? CBD can raise up the blood level of everolimus, and it can be extremely high. So if you have a combination of everolimus and cannabidiol, you have to lower down the dosage of everolimus. This is very important. It's nearly half of the doses which you have used before. And sometimes it can also have a positive side effect, cannabidiol. It can make better mood, depression or aggressiveness can be reduced, or sleeping problems can be reduced. So these are positive side effects. But it also has other side effects, cannabidiol. The liver enzymes can be elevated, and you have to look for that carefully. And it's not just a plant medication. It's really a therapy with side effects. So this you should only do with medical assistance or under the device of a medical doctor. Okay, SOS medication. What are SOS medication? There is a great group of benzodiazepines. It's Bucolam, which is mostly used in Germany, and I think also in the other European countries. You can use Bucolam or Midazolam. Midazolam is the chemical name. You can use it orally, just with a syringe going into the mouth on the side and just injecting it into the mouth, and it will be absorbed from the mucosa of the mouth. Or you can give it, if you take the intravenous substance, you can inject this intranasally or intravenously. So everything with midazolam is possible. So at home, you can only use it orally, that's for sure. Or in certain conditions, if you really have a high incidence of status epilepticus, you can also use it with nasal application. The older drug, which is very common, is still very common, is diazepam. You can use that rectal or with oral drops, or also intravenously. And the other one is clonazepam or Rivotril, which is the name you will buy in the pharmacy. This is also oral and intravenously, as well as lorazepam, which is the other benzodiazepine. So this is normally the first group which you are using in seizures if they are not ending by themselves, and if they are lasting longer than 2 to 3 minutes in generalized tonic-clonic seizures, or lasting longer than 10 minutes in tonic in focal seizures, or a series of tonic seizures. Sometimes you also have atypical absences or just a dreamy state, and there also it can be used after a certain time. That means after 15 to 30 minutes, it depends, and you have always to speak with the doctor. The rescue medicine or SOS medicine should always be used individually and always in contact with your treating doctor. And what else do we use as rescue medication? Sometimes we also give for focal seizures if they are coming in series or clusters. We are using levetiracetam. You can give it also orally. So that means if you have focal seizures coming up every 10 to 15 minutes, then between the patient is consciousness, then you can give an oral tablet of levetiracetam, 500 milligrams, for example, and this is also very effective. But you can give levetiracetam as well intravenously, as well as other anti-epileptic drugs like valproate, lacosamide, or in status epilepticus, phenobarbital or phenytoin if the other benzodiazepines are not well working. And in status epilepticus, as I mentioned before, if the especially a great tonic-clonic seizure is lasting more than 10 minutes and it's not reacting on phenobarbital or phenytoin, at the end you are going to intubation and going over to a thiopental anesthesia. So that is a common way to use rescue medicine or SOS medicine. So, because infantile spasms have such difficult or disastrous consequences in declining development, if you think about that your child is in the typical age of infantile spasms, that means about 5 to 6 months or even 3 months up to 12 months, and he is doing some specific movements which can be infantile spasms, then you should contact your doctor as quick as possible. And it would be very helpful if you have taken a video with your handy, with your camera, to show the doctor what's going on. Because what he needs to do is doing an EEG when he is suspecting infantile spasms to see what's going on the EEG and then starting the treatment. So that's really very important.